Hi students, welcome to the next session in oral pathology. I'm Dr. Gopi Krishnan discussing oral pathology with you. Okay, so in this video we are going to discuss about a small topic, very small topic, that is benign epithelial lesions. Okay, benign epithelial lesions. So we are going to start about our epithelial lesions in the oral cavity. In that we will first start with certain lesions which are benign growths in the epithelium of your oral cavity. So the oral mucosa is having a little a growth which is very much benign. Okay, it is not malignant and it is benign. So we have four major things, 4 to 5 major things which they ask questions in. Okay, the first and foremost and very important is your squamous papilloma. Okay, so in this image you are seeing a growth. Okay, can you see that growth over the tongue? It is finger like growth, right? A cauliflower like or finger like growth. The condition here, it is called squamous papilloma. Okay, squamous papilloma. What you mean by squamous papilloma is that squamous papillomas are papillomatous growth or finger-like growth over the oral mucosa. Okay, so the your mucosal epithelium will proliferate a little. Okay, it will proliferate a little and it will make finger-like projections like this. Okay, so squamous papilloma is actually the most common benign tumor. Benign epithelial tumor. Okay, epithelial tumor of your oral cavity. Okay, so papillomas are most commonly seen, and papillomas are most common in the palatal region. Okay, palatal surface is the most common site for this papillomas, not your tongue is not the most common site, palate is the most common site. Okay, then comes what's the reason, what is causing this papillomas. Okay, what is the trigger? You know that there is a virus called HPV virus, human papilloma virus. Human papilloma virus. Human papilloma virus is the causative. Okay, human papilloma virus is the causative for this lesion. Human papilloma virus, HPV family. Okay, HPV family is actually a large family of virus. Okay, and there is both low risk virus and high risk virus in this. Okay, HPV is divided into two. We have low risk virus and high risk virus. Low risk virus will cause only this benign lesions. Okay, just like squamous papilloma. Okay, condyloma acuminatum. Okay, hex disease. All these are caused by low risk virus. Okay, they won't cause any malignancy, but HPV is equally capable of making malignant epithelial lesion. They are capable of making squamous cell carcinoma. Okay, but that category is the high risk HPV virus. So one of the neat paper, they asked which among the following is a high risk HPV virus. Just remember 1618. Okay, 1618 is a high risk HPV virus. HPV 16, HPV 18. There are so many other than that, 35, 32. That doesn't matter. Please remember HPV 16 and 18 at least. Okay, in high risk category. And in low risk category, you have HPV 2, 4, 13, 32, 13, 32. Okay, 2, 4, 6, 11. 2, 4, 6, 11, 13, 32. Okay, so just remember they are the low risk viruses. Low risk HPV virus which can make only benign lesions. So main reason for this squamous papilloma, okay, the squamous papilloma is your HPV 6 and 11. HPV 6 and 11 is the main reason for the squamous papilloma. Okay, so this is a clinical presentation where you see what finger like or cauliflower like growth. Now if you take the histology, so this is the histological picture, doesn't matter, don't be afraid of seeing all these things. We have cut it and you can see finger like projections. See, this is the papillomatous projections, right? It has that finger like papillomatous or we say finger like projections, finger like epithelial growth, right? Epithelial growth you can see in this, and you know that this epithelial growth has a central connective tissue, right? In the center you have connective tissue core. Okay, this is the connective tissue core in the center. Okay, I will draw it with a different color. Can you see this these are all cores of the connective tissue which is supporting this growth. Now interesting thing in this squamous papilloma or any virus related lesions. Okay, so you know that the virus, they attack the nucleus of a cell. A virus needs to proliferate, so they attack the nucleus of a cell. So when an epithelial cell is attacked by a virus, okay, when an epithelial cell is attacked by a virus, attacked by any virus, okay, what happens is that they will attack the nucleus. Okay, they are going to attack the nucleus because they want the nuclear machinery to replicate, and they will convert this epithelial cell to a damaged cell, and that damaged cell has a particular appearance. That cell will be large. Okay, they will have a large balloon like cell, ballooned cell. Okay, it will become bulgy, and the nucleus will be like this. Nucleus will be damaged, and nucleus will be right like a resin. Okay, like a resin like nucleus. Resin like nucleus. You know, resin, by what I mean is resin. You have seen this dried what grapes, dried grapes, and all that is what we call resin. So nucleus will be damaged, and nucleus will be getting a shape of a resin. Okay, so that is called a pycnotic nuclei. Pycnotic nuclei. So the cell will get large, the cytoplasm get large, and the nucleus will be shrunken, and there will be a perinuclear halo also. They will have a perinuclear halo around this nucleus. There will be a halo. Okay, they have a perinuclear halo. Okay, see this cell which is attacked by a virus, the epithelial cell which is attacked by a virus, which have a large cytoplasm, pycnotic nuclei, and a perinuclear halo. These cells are called coelocytes. Coelocytes. Okay, so you see a lot of coelocytes in this virus related epithelial lesions. Okay, so either be squamous cell, either be the squamous papilloma, or be the condyloma acuminatum, okay, or be the hex disease, whatever it be. These cells, these epithelial cells which are attacked by this virus is called coelocytes. Okay, so this much is there in your squamous papilloma. Okay, now this is also a picture of squamous papilloma which has occurred in the palatal region. Okay, that is the clinical picture. And one another viral lesion is called condyloma acuminatum. So first one was your squamous papilloma. Next one is condyloma acuminatum. This condyloma acuminatum is other type of viral lesion which is occurring in the oral cavity. It will also look like a papule, or it will also look like a swelling or a small bump on the oral cavity. Okay, and it will also look like a papule or a bump on the in the oral mucosa. Okay, and the difference is that here the HPV 611 2611, this HPV 2611 is causing this condyloma acuminatum. This is also a low risk virus, and there is nothing much you can see here. And condyloma acuminatum will also have histologically, it will also show this coelocytes. Okay, histologically, if you see histologically, it will also show coelocytes. And condyloma acuminatum has a feature that this epithelial lesion is most associated with HIV. Okay, it can come associated with the HIV. Okay, in HIV patients, there is high chance that you see this condyloma acuminatum. So, which among the following epithelial lesion is associated with HIV? Okay, they will give you options: squamous papilloma, condyloma acuminatum, etc. So you remember what's the specialty of condyloma acuminatum is this is also a viral affected epithelial lesion, and it is caused by low risk virus, human papilloma virus, low risk category, and it is associated with HIV. But okay, only this much. And the third one, I think if so many papillomas or so many eruptions are there in the oral cavity, so many bumpy growths, or so many cauliflower like growth are multiply present in the oral cavity. Okay, it is called a multifocal epithelial hyperplasia. Okay, multifocal epithelial hyperplasia, you see in this picture here. Can you see the tongue here? So you have one eruption here, second one here, third one here. Can you see that growth? It is just like small nodular eruptions, right? It's all over the tongue. It is present all over the tongue. It is multiple presentation. Such a presentation we call it as hex disease. Hex disease. The other name of multifocal epithelial hyperplasia is hex disease. Okay, and here it is caused by your HPV 13 and 32. Okay, and this appearance, can you see this appearance? It is called cobblestone appearance. Okay, cobblestone appearance. Okay, and here also you see coelocytes. Here also you can see coelocytes. If you see the histopath, if you take the biopsy of this lesion, you can say that you can see coelocytes. Coilocytes you can see, and along with that you can see a particular type of cell in this multifocal epithelial hyperplasia, that is called a mitosoid cell. Mitosoid cells means these cells will look like they are dividing. Mitosis, okay, they are looking like their nucleus will look like that they are going to divide. There is mitosis happening inside, that is called a mitosoid. Okay, I have told you before also, epithelioid, plasmacytoid, mitosoid, means it is looking like. Okay, so this is a peculiarity of Hex disease. Hex disease has mitosoid cells. So just you have to just to remember what is the specialty of each, that is enough. Okay, now the last one, I have one more benign lesion, that is viral induced, that is called condyloma, molluscum contagiosum. Molluscum contagiosum. Molluscum contagiosum. Now, what is the causative for molluscum contagiosum? So every time it is not HPV. Okay, every time it is not HPV. That's why there was a question in the NEET paper: which among the following is HPV induced, or all the following is HPV induced except. So in that the options were squamous papilloma, condyloma acuminatum, multifocal epithelial hyperplasia, and the fourth option was molluscum contagiosum. So molluscum contagiosum is caused by your molluscum contagiosum virus, MCV. That is actually pox virus. Okay, it's a DNA virus, as pox virus, molluscum contagiosum virus. Okay, and here also you will see the presentation is similar. It is also similar like your Hex disease. It will also look like multiple papules. Okay, multiple papules are seen all over the body, all over your oral cavity. Okay, on your lips, buccal mucosa, you can see multiple papules. And the peculiarity of this molluscum contagiosum virus is that it has some kind of inclusion bodies. Okay, inclusion bodies means so those bodies which are present, okay, in the nucleus. These called nuclear inclusion bodies. Inside the nucleus, inside the nucleus of cell, you have some inclusions. It is called intranuclear inclusions. What is the peculiarity of this molluscum contagiosum virus? Molluscum contagiosum disease, it is caused by your molluscum contagiosum virus, and it will present similar like the Hex disease. The only speciality is that those cells which are affected by this molluscum contagiosum virus, inside their nucleus they will have some inclusion bodies, some extra bodies or extra material which we present inside the nucleus, and that is called a Henderson Patterson bodies. Henderson-Patterson bodies. Okay, or we say molluscum bodies. Henderson-Patterson bodies. This is a specialty of molluscum contagiosum. Nothing more you need to learn and hear. Okay, so this is about our benign lesions in the oral cavity. We have seen squamous papilloma. We have seen what are the HPV category, the low risk and high risk HPV category we have seen. And then we have seen about the coilocytes, about the resin-shaped nuclei, the pycnotic nuclei. And then we have seen condyloma acuminatum. What is the specialty? It is also HPV virus, HPV low risk virus, but it is associated with HIV. And then third one we saw multifocal epithelial hyperplasia. Okay, there you have seen the mitosoid bodies. And the fourth one, molluscum contagiosum, where it is caused by MCV, not your HPV. And there is Henderson-Patterson bodies, which is inside the nucleus. Okay, so I hope you understood the benign lesions of the epithelial benign lesions of the oral cavity. See you in the next video with a new topic.